In the spotters discussion today, I was showing the residents regarding the single lumen dialysis catheter. If you look at the cover for the specification, the length and the diameter in the form of gauge they have mentioned, which is mentioned as 14 gauge. In most of the catheters, the measurement used is FG, which is French gauge. Here they have mentioned it as gauge, which is 14 gauge. Length, the name, these three are the things which are mentioned over there. If you open it in the exam, you might get this catheter. This is how it appears. The white color portion is the intravascular part, which is being covered with the plastic material, which I removed it right now. There's a lock and the cap. As in the specification it was mentioned, it is 14 centimeter. Here there is a cap which can be opened, with which the blood will be taken out for the dialysis purpose. This entire white color portion is the intravascular one, and there is a lock with which it can be locked, but there are no skin suturing site for this catheter. It has to be just adhesed with the help of adhesive tape. What is the question you might, when we compare it with a double lumen catheter, this is how the comparison is. You can look at the size difference. The size difference between the single lumen and the double lumen catheter. As the name is self-explanatory, there are two lumen with which blood can be taken out and sent back. This is the entire package with which the double lumen catheter comes, along with the guide wire and other instruments. In the specification, if you see, it is mentioned as French gauge. In terms of French gauge, 1 mm equal to 3 French gauge. In terms of gauge, 7 gauge equal to 1 mm. Mostly we use French gauge. At least for the approximate conversion, the single lumen catheter is mentioned as 14 gauge, which is 2 mm. If I convert into French gauge, 1 mm equal to 3 French gauge, so it is 6 French gauge in terms of it. So the bigger one is 12 French gauge. So this is the size difference. And the advantage is, there is the chance of DVT is less with this single lumen catheter. The question which might ask at this point of time, how long it can be kept inside, and what are the advantage and disadvantage of femoral as a dialysis catheter site, and what is the another disadvantage of the single lumen catheter. Because it is only one, you need another catheter or IV cannula to return the blood. Once it is taken for dialysis, you have to return it to the some other port, whereas in the double lumen catheter, arterial port and venous port is there, so blood can be taken out and returned to the same catheter. Here only one lumen, so you need one more prick or cannulation to return the blood to the patient. And what are the situation where you will prefer the single lumen, can be a question. And another difference is that skin holding part which is present in the double lumen catheter, not in the single lumen. Here I want to push some saline into both the port, and you can see from which area the saline comes out. If you look at the single lumen catheter, if I push it, it is coming through the tip and the micro holes around the tip. In the double lumen catheter, there are arterial port and the venous port. Arterial port is the area from which we take the blood, and the blood goes to the machine. If I push the saline from this side, you can see the port is somewhere located at that position as I showed there. If I push the saline in the blue port, which is the venous port, the blood with which the blood enters the patient body, the port hole is located at the tip. For the arterial port it is there, and for the venous port it is here. So this is how the blood in the same catheter, the blood being distributed to the machine and back to the patient. The understanding is very important because the chance of recirculation is there if the port is interconnected. And for a DM resident, they might ask what is recirculation, how to calculate recirculation. These are all the questions they might ask a DM resident. This, though, I already told, the skin holding part which is present in the double lumen catheter is not present in the single lumen, and the double lumen is the curved one. There are other catheter which come